Hello, and welcome to This Explainer. Today we're tackling one of the absolute most common male health conditions worldwide. But, despite how prevalent it is, it remains one of the least discussed. We're talking, of course, about erectile dysfunction, or ED. Because of the stigma and, frankly, the embarrassment surrounding it, so many men hesitate to seek medical advice. They just kind of assume it's a normal part of aging, or that nothing can really be done. But those misconceptions delay diagnosis and treatment for a condition that is actually very often manageable once we figure out the underlying cause. So today, we're going to strip away that stigma, look right past the embarrassment, and focus entirely on the rigorous medical science and the actual biology of what's happening in the body.
Okay, let's dive into this. On our agenda today, the truth about ED, defining the condition, why it's a critical health warning sign, the biology of an erection, and finally, when the system fails.
Section 1. The truth about ED.
The absolute most pervasive myth out there is that this is exclusively an older man's issue. Let me be clear. It's not just an aging issue. Yes, the likelihood of developing ED certainly goes up as we get older, but younger men are highly susceptible as well. Why? Because ED is fundamentally tied to our overall lifestyle and health. We're talking about factors like obesity, diabetes, smoking, chronic stress, severe anxiety, and even just poor sleep. All of these can contribute to ED in men of literally any age. Plus, erectile function isn't just a simple binary of working or broken. It's on a spectrum. Some guys might only notice occasional difficulty, while others might lose rigidity during intimacy or be entirely unable to achieve an erection at all.
Section 2. Defining the condition.
So the crucial point is that word persistent. The clinical definition of erectile dysfunction is the persistent inability to achieve or maintain an erection sufficient for satisfactory sexual activity. Look, almost every guy is going to experience occasional difficulty at some point in his life. If you're dealing with profound fatigue, crazy emotional stress, a lack of sleep, or hey, if you've simply had a bit too much to drink, those isolated episodes do not equal erectile dysfunction. Physicians really only start to get concerned when these problems happen repeatedly over several weeks or months, and when they actually start interfering with your quality of life.
It is also super important to prevent self-misdiagnosis by distinguishing ED from other sexual disorders. I want you to think of ED as a mechanical issue. The machinery just isn't cooperating. Now, this is very different from premature ejaculation, which is essentially a timing issue, where ejaculation happens sooner than desired, often within a minute, even though a totally normal erection is achieved. And both of those are entirely different from low libido, which is a desire issue, meaning a reduced drive for intimacy rather than a physical difficulty in getting an erection. While they can definitely occur together, they are totally different medical problems that require completely different clinical approaches.
Section 3. The health warning sign.
Now, this is where we need to shift our perspective from a localized mechanical problem to a systemic health alert. A lot of people think erections are only about sexual performance, but clinically speaking, they are considered a major indicator of your overall vascular health. Basically, think of ED as the body's check engine light. The arteries that supply blood to the penis are relatively tiny compared to the arteries supplying your heart or your brain. Because they're so small, reduced blood flow caused by conditions like atherosclerosis, which is the hardening and narrowing of the arteries, will almost always show up here first, long before symptoms develop anywhere else in the body.
And that brings us to an incredibly alarming statistic. Several large clinical studies have shown that erectile dysfunction can actually precede major cardiovascular events, we're talking heart attacks or strokes, by several years. Several years! This is exactly why doctors view ED not just as a sexual symptom that needs managing, but as a golden opportunity. It's a chance to evaluate a patient's overall cardiovascular health and, quite literally, potentially save their life.
Section 4. The biology of an erection. Let's move to this D and see how this builds.
Achieving a healthy erection requires a bunch of body systems, the brain, nerves, blood vessels, hormones, and muscles to all function in perfect harmony. And it happens in 5 distinct steps. Step 1 begins right in the brain with sexual stimulation, which processes signals and fires messages down the spinal cord. Step 2. Those nerves reach the penis and release a really crucial chemical called nitric oxide. Step 3. Blood rushes in and fills 2 cylindrical structures inside the penis called the corpora cavernosa, and these expand a lot like a sponge soaking up water. Step 4. To keep that erection firm, the veins that normally drain blood away actually get compressed, trapping the blood inside. And finally, step 5. Following orgasm, or when the stimulation ends, the smooth muscles contract, those veins reopen, and the blood exits.
Now, the incredible importance of step 2 hinges entirely on nitric oxide. This is a vital chemical messenger whose specific job is to relax the smooth muscles surrounding those penile arteries.
When that muscle relaxes, the blood vessels can widen. Without the release of this very specific chemical, adequate blood flow is biologically impossible. You literally cannot achieve step 3 if step 2 doesn't happen.
Section 5. When the system fails.
And this brilliantly illustrates how specific medical and lifestyle disruptors can directly break down that delicate 5-step process we just reviewed. Because the process requires so many bodily systems working together seamlessly, a disruption at any single stage halts the whole sequence. If a patient is dealing with intense anxiety or depression, the brain can't generate adequate stimulation, so step 1 fails. If a patient has diabetes or maybe a spinal cord injury, nerve damage stops the signals from reaching the penis. If a patient has narrowed blood vessels from smoking, high blood pressure, or high cholesterol, well, insufficient blood reaches the erectile tissue. Low testosterone can kill the desire entirely. And over time, smooth muscle damage means the tissue just can't relax appropriately to let blood in. So you see, ED is almost always a symptom of one of these underlying disruptors. It's also absolutely critical to understand that this is a gradually progressive condition. The system doesn't usually just fail overnight. It starts with incredibly subtle changes. A guy might notice that his erections are slightly less firm, or that morning erections are becoming way less frequent. Maybe maintaining rigidity just becomes a bit more of a chore. Over months or years, these occasional symptoms become frequent, which leads to performance anxiety. And that just worsens the problem, creating this vicious cycle where men start avoiding intimacy altogether out of fear of embarrassment. If the underlying conditions, like high blood pressure or diabetes, are ignored, mild ED will absolutely progress to severe dysfunction.
Recognizing these early symptoms is paramount, not just for your intimacy, but for your life. Physicians actually classify erectile dysfunction into 4 distinct levels of severity, using the internationally recognized IIEF-5 scoring system. Understanding these levels helps pinpoint exactly where you might fall on this spectrum, allowing for early medical intervention. So I want to leave you with this thought. If ED exists on a spectrum, and it is a critical warning sign for your heart and vascular system, which of the 4 warning levels might you be ignoring? Thank you so much for